Now at 6, tracing coronavirus. The tri-state launches a new tool to fight COVID-19, and it has the backing of a billionaire. Feeling the pressure in New Jersey, the number of cases approaches 100,000, where hospitals are being pushed to the brink, and the new action the governor's taking. Plus, coronavirus in cats, the first cases in household pets right here in New York, and more animals test positive at the Bronx Zoo. We break down what you need to know. Good evening. Thanks for joining us. I'm Natalie Pascarella.
And I'm Chuck Scarborough. An ambitious new effort is about to begin in the battle against COVID-19 with the help of a familiar New York billionaire. Governor Cuomo announced a tri-state coalition to launch contact tracing, backed by former New York City Mayor Michael Bloomberg. The goal is to control the spread by tracking down everyone who may have been exposed to an infected person. There are some positive signs in New York City's fight to control the virus. ICU admissions and the number of positive tests dropped over the last 24 hours. But the number of total hospital admissions did rise slightly. And the city's launching a new effort to keep seniors connected. Mayor Bill de Blasio says NYCHA is going to provide 10,000 tablets with internet to seniors who live in NYCHA buildings at a price of $5 million. News 4's John Chandler is live in Brooklyn Heights with another announcement from Mayor de Blasio about a summer tradition in the city. John?
Yes, Chuck, the fireworks on the 4th of July. It would certainly be an uplifting scene to see them in the air this 4th of July. But still, many New Yorkers we spoke to today wonder if, with parade talk yesterday and now fireworks today, Mayor de Blasio is getting a little bit ahead of himself, especially in light of the ambitious plan to improve testing and tracing that he and the governor discussed today. Still, amidst all of this, there are signs of progress. Guillermo Usme walks out of Mount Sinai Hospital in Queens, a COVID-19 survivor.
I'm happy.
His recovery offers hope, a feeling perhaps fueling Mayor de Blasio's push for 4th of July fireworks.
Recognize social distancing, but this is a day we cannot miss. This is a celebration that has to happen.
The mayor's sentiment understood, even appreciated, but questioned along the Brooklyn waterfront, where ambulances are parked 10 deep. And New Yorkers stroll wearing masks.
It strikes me as maybe not the best year to do it.
We have to see what the situation's like. If I would never do it today with the pandemic going on.
Even as hospitalizations decline and the USNS Comfort is no longer needed, city and state officials are loath to let up. Instead, they're pushing to ramp up testing and tracing. 40,000 tests a day is the pledge now. Hundreds of thousands a day is the point they aim to reach.
This is the only way we can get out of this phase we're in and to a better situation.
And the current mayor's call for tracing gets a boost from the former. Mayor Bloomberg will oversee regional contact tracing in New York State and bankroll $10 million towards it.
This has to happen. You don't have months to plan and do this. You have weeks to get this up and running.
That urgency underscored by hundreds more dead. Over 15,000 New Yorkers now lost to coronavirus. So the city races to open testing centers. 3 NYCHA developments on Friday with more planned. And public buildings could convert to testing sites next month. All signs of work that remains. Work that many think might suggest New York is not ready for fireworks.
When it comes to a big event like that, it literally attracts close to hundreds of thousands, if not a million people along the waterways. It'd be very difficult to do that if we're in the same situation we're in now.
And certainly the waterfront here in Brooklyn, shoulder to shoulder in a normal year with the fireworks going off. Mayor de Blasio acknowledging he's still not certain what it would look like in the midst of a pandemic this year. We're live in Brooklyn Heights. I'm John Chandler, News 4 New York.
John, thanks. Tonight, there is an alarming development to tell you about coronavirus and your pets. Just a few hours ago, the CDC revealed that 2 cats in different parts of New York State have COVID-19. And these are the first known cases of coronavirus in house pets. News 4's Ida Siegel live in the Bronx with what this means for pet owners. Ida.
And Natalie, especially alarming because, as you mentioned, this is the first recorded time in the United States that household pets have tested positive for the virus. Up until this point, it was generally understood that the virus could not be transmitted to pets. But now the CDC is revising its recommendations for how we interact with our pets in light of this news. The CDC says, as you mentioned, that 2 cats in different parts of New York State have tested positive. And what's particularly interesting is that one cat had an owner who had a positive case of COVID-19, and it's presumed that owner transmitted the virus to his cat. But the other infected cat lives with a family where none of the members were known to have the virus, so it's unclear how that cat contracted the disease. Both of these cats were treated for respiratory distress and are expected to be fine, but now experts are recommending sick people be especially careful around their pets so as not to infect them. And the natural question then becomes, can an infected cat get a human sick?
The current thinking is that cats cannot transmit coronavirus back to people. I think that we have to watch that closely. I think that any human who has coronavirus should be very aware of contact with their pets as well as other family members.
You'll recall it was just a couple weeks ago that the Bronx Zoo announced that a tiger had tested positive for the virus. Well, tonight they are confirming it's a total of 8 cats at the zoo confirmed to have coronavirus. We're talking about both tigers and lions. All are expected to recover, and the zoo is still closed to the public at this point. Reporting live from Riverdale, Ida Siegel, News 4, New York.
Ida, thank you for all that new information. Well, the city council held its first ever remote meeting and the first since the city shut down over COVID-19 concerns. Council members introduced a relief package with measures to protect tenants, small businesses, essential workers, and the homeless. Speaker Corey Johnson said it is unacceptable that communities of color and low-income communities are hardest hit by this virus. He said they need help with health care and with recovery.
The rate of infections continues to slow across the tri-state, but thousands are still testing positive for the coronavirus. More than 375,000 people have been diagnosed and nearly 22,000 have died from the virus. New Jersey is approaching nearly 100,000 cases, and pressure is building on some of the state's hospitals. News 4 investigative reporter Chris Glorioso is live in Paramus, where Governor Murphy toured a new medical facility built by the Army Corps of Engineers. Chris?
That's right. And although the curve is flattening here in New Jersey, Governor Murphy stressed it would still be weeks before state restrictions could be lifted. However, he also stressed that he is working on long-term plans to open up the economy, long-term plans for testing and tracing coordinated with other states in the region, and long-term plans to increase hospital capacity, including here at the Newbridge Medical Center.
As we look toward, for instance, a reopening strategy, which we are working on finalizing now, one of the first things we need to be prepared for is the spike in new cases that will surely come when we do reopen.
Governor Murphy stressing he wants to keep expanding hospital capacity, not just for the present, but for the future, because New Jersey may need more beds in a potential second wave of the virus. Wednesday, he announced the state has successfully purchased 500 new ventilators. He also visited Newbridge Medical Center and East Orange General, 2 hospitals now adding 380 new beds.
What we're going to see, again, is a need for these certain populations that are going to need a place to convalesce, to rehabilitate, restorative care, longer-term care.
Deborah Visconti is president and CEO of Newbridge. It is New Jersey's largest capacity hospital. Here, they're spraying down surfaces with something called nano vapor to disinfect. Though New Jersey is now seeing more COVID patients discharged from hospitals than being admitted, on Tuesday there were more central Jersey hospitals needing to divert patients than there were in northern New Jersey. Meanwhile, the state's COVID death toll has passed the 5,000 mark. About 40% of that total, nursing home residents. Mitchell Haber and his sister just lost their 91-year-old father on Sunday, one of the dozens who have died inside the veterans' home at Paramus.
If they die in the hospital, which they would, the numbers don't go against the nursing home. They go against the hospital numbers. If they were to die here, which they got sick here, those numbers would be way up to what they're reporting.
Governor Murphy said the numbers at nursing homes remain troubling, and he also signed an executive order requiring all medical facilities report the race of people who die of COVID. For now, reporting live in Paramus, Chris Glorioso, News 4, New York.
Chris, thank you. Just a little more than a month after losing a founding member of their group to coronavirus, the New Jersey band Fountains of Wayne is taking part in a special pandemic relief benefit.
It hit close to home, and I hope it doesn't hit it, closer to anybody else's homes. So that's why everybody needs to, keep practicing the social distance and just try not to go out very much.
Adam Schlesinger was a founding member of the group. He died on April 1st at the age of 52. The group is known for the song Stacy's Mom. Well, tonight, the band will join dozens of other famous New Jersey folks for a special televised event, Jersey for Jersey. You do not want to miss this. It's a 1-hour special. It airs right here on NBC4 tonight at 7 o'clock, and that's right after NBC Nightly News.
In Connecticut, one company is effectively creating a new supply of those precious N95 face masks. Mattel has installed a machine in New Haven that cleans tens of thousands of N95 masks every day. Now, remarkably, according to the company, those masks can be cleaned and safely reused up to 20 times. Thanks to grants from the federal government, the service is free to hospitals.
Well, New York hospitals will get the lion's share of what are being called hotspot funds out of Washington. The $10 billion appropriation will be shared by 100 counties across the U.S. hardest hit by the virus. Nearly half that money, $4.4 billion, goes to counties in New York State. New York hospitals are reportedly losing hundreds of millions of dollars per month because of canceled elective procedures and the surge in COVID-19 patients, Chuck.